Good evening, and thanks everybody for joining us for this Recovery Town Hall hosted by Delaware's Lieutenant Governor Bethany Hall-Long. This is our first public Recovery Town Hall. We've held a couple, some of you may have seen, small business Recovery Town Halls with the small business community across Delaware and members of Delaware's General Assembly. We have with us today Lieutenant Governor Bethany Hall-Long, Secretary Cade from the Delaware Department of Labor, Dr. Rick Hong from the Division of Public Health, and Damian DeStefano from the Division of Small Business. We have a lot of pre-submitted questions that I'm gonna read tonight, and we're also gonna get to your questions in the comment section. So please leave a question or feedback. Also, please visit de.gov/economy. You can learn more about Delaware's reopening process and what the role you can play in that process by submitting public feedback. So with that, I'd turn it over for opening comments to our Lieutenant Governor, Bethany Hall-Long.
Thank you, Jonathan, from the governor's office. Well, good evening, everyone. And I just really want to give a shout out and a great thanks to all of you who've taken the time from your evening to join us as we look at our recovery and our economy here in Delaware, as we particularly tonight focus on Kent County. I'm Lieutenant Governor Bethany Hall-Long, and it was stated previously, I'm so thrilled that this evening we have our Secretary of Labor, Cerron Cade, my friend, Dr. Rick Hong, who is the Medical Director of the Division of Public Health, and Damian DeStefano, who's the Director of Delaware's Division of Small Business. Last week, we know Governor Carney announced a series of recovery town halls, some of whom you have probably joined us in the last couple days, to engage Delawareans to talk about safely opening our economy. We've heard our governor say many times we need to have a healthy community before we can open and have a fully healthy economy. But to look forward, we really need to have plans. We need to have your feedback and your input. Whether you're a mom, a small business owner, a father, your input really matters. And so tonight, as we gather that, we want to think about those safety steps as we reopen and do it in the right way. All of us, our lives have really changed the last few weeks, and it's been challenging for many of us as we try to think about how we function, how things have kind of been upended some. So tonight, as we try to think about moving forward and we work toward creating a plan to reopen, we have to find that balance of our economy and making sure we are safe overall, both our physical and our emotional well-being. It's a new normal and things are looking really differently for us. And speaking of looking differently, those who've been behind the scenes every day working tirelessly for Delawareans are many of the elected officials who are listening in, who are participating in this Facebook streaming tonight. And those are Representatives Bush and Bennett, Carson and Lynn, Spiegelman, Postals, Urick, and Morris. We thank you. And from our Senate side, Senators Pardee, Ennis, Lawson, Bonini, and Wilson. And in turn, we have many from our local municipalities, our levy court, our Kent County government, our local leaders and nonprofits, and our chambers of commerce, many of you who are health providers and first responders. We just say thank you for coming out as we address this pandemic, something that we haven't faced. And we understand we have to get your feedback tonight as we safely open. And as we heard from Jonathan, we may not get to everyone's question. We'll do our very best to have that during our chat, but please do visit de.gov/economy. Fill out the form on the bottom of the site. Again, de.gov/economy. Many of you have submitted questions in advance, and I know our moderator tonight, Jonathan, is going to be reading those from our website, and we have those experts with us again this evening who've taken the time to join us. So we will be posting again this link where you'll have more details for our reopening coming forward. And again, we're pleased that Dr. Rick Hong has joined us tonight. We have seen, as you all have read and heard, of the uptick in our positive cases, particularly in Sussex County. We know that Dr. Hong may have to sign off a little earlier this evening. I know he's working closely with the Centers for Disease and Control, and we thank him for his dedicated service. In turn, we've continued to build upon Governor Carney's leadership with many executive orders. Thank you to each of you for participating and cooperating and protecting your neighbors. We're expanding our testing sites. And you know, as our team is here from the CDC, not only looking at Sussex, it's bettering the health of us across our state. With the executive order yesterday, whether it's you're covering your face when you're out in your public setting or continuing to stay at home as we protect others, we thank you for taking those measures. We all recognize that we want to get back to our economy. We want to get back to where we were. And with your feedback tonight and your input, we'll continue to build on that and try to reopen Delaware safely. So we're going to hear some brief opening comments now from a couple of our guests who've joined us, and then we'll go right to those question period. Right now, I'd like to introduce our secretary, Cerron Cade, who will then give us some opening comments and thoughts, and then we'll come back to our other guests. Secretary?
Hello, thank you for inviting me on the call today, Lieutenant Governor Hall-Long. As we all know, the state of Delaware has received the highest number of unemployment claims over the last 6 months, or 6 weeks rather, than we've ever seen in one period of time. This has caused numerous stress for workers, as well as strain on our system, but we're working around the clock to make sure that we get benefits to people. So I won't take up too much of the time that we have, other than to say that most recently we have paid out over $50 million in benefits to workers, nearly about $60 million actually, in benefits to workers since this began. And we have paid out benefits to more than 55,000 individuals during this time to assist them as they stay home to stay safe from the virus. So I'd like to turn it over to Damian DeStefano, who works with our Division of Small Business, who has been dealing with a lot of the incoming requests for assistance from small business.
Good, Damien.
Thank you, Secretary Cade and Lieutenant Governor. My name is Damian DeStefano. I'm the director of the Delaware Division of Small Business under the Department of State. And our division has tried to be on the front lines of helping small business owners get through this incredibly challenging time. For those on the line who are small business owners or who work for a small business, and really all of you out there who are working in the situation that we are now finding ourselves in, I just want to let you know we hear from you, and I sympathize with what all of you are going through. We hear from small business owners all the time who tell us the stories and challenges they're having. And if we can be helpful, I'd love to do that.
Thank you. Thank you for that. Now we'll turn to our colleague from the health field, Dr. Rick Hong, for a brief introduction, and then we'll be coming back, I think, Damien, to you for a couple slides. Dr. Hong.
Yes, so this is Dr. Hong, the Medical Director for Division of Public Health, and I really appreciate this opportunity to be part of this town hall. We understand what we've been asking the public to do for the safety of individuals as well as the public in general, and we appreciate your support for this. This has been trying times, tough times. You know, shout out to our first responders, healthcare workers, critical infrastructure workers as well, for trying to do their best to maintain our daily living. We also understand the importance of a healthy economy in relation to health. So our main goal is to make sure that when we decide to open, that we don't see a second peak, and we balance that public health aspect with a healthy economy. So thank you very much.
Thank you, Dr. Hong. And with that, we'll go back to Damien. I believe we have a couple slides that we were going to look at this evening about following the White House plan and the CDC and kind of the phase out.
Thank you, Lieutenant Governor. Yeah, so I know that Governor Carney has laid this out in the past, but I just wanted to talk a little bit in detail about the phases with which we'll go through as we enter a recovery phase from the pandemic, or from the containment efforts related to the pandemic. The CDC guidelines lay out 3 phases of recovery. We're going to talk tonight about the first 2 phases. In phase 1, which is hopefully the phase we will be in sooner rather than later, you're going to see some changes, but I think a lot of the things that we are doing now are going to need to stay in place. Again, I think Dr. Hong said this: we need to gradually reopen things to make sure that we don't have a second outbreak, which would really cause immense harm, both from a public health perspective, but from an economic perspective, if we have to open things up and then roll it back. With the uncertainty that might cause in when things might be reopened. So given that framework, the approach we're taking and within the CDC guidelines is very much about a cautious reopening, making sure that our vulnerable individuals are still sheltering in place, maintaining social distancing, keeping in place the limits on public gatherings, and opening businesses in a limited fashion where they can be sure to operate within those safe guidelines, and when customers can feel confident in going out to those businesses that they're going to be able to be in an environment where their health is a priority, and that their social distancing is being maintained. So you can see on here on the slide some of the different things that this might mean, but those are the principles with which we're approaching this part of the project. As we move into phase two, again, things aren't going to be completely back to normal, but you'll start to see some more of those things, and a little bit more of the ability to go out and to more seating capacity at restaurants. You start to see school and youth activities potentially return. Still have to pay close attention to our vulnerable populations, still have to be diligent about maintaining safe social distancing, but non-essential travel can resume. We can start to go back to having larger events. Instead of 10 individuals, we go up to 50. Again, getting a little bit back to normal gradually to try to make sure that as we do that, we're continuing to monitor the data from a public health perspective. We work closely with the folks at Division of Public Health to make sure that we're keeping it under control, we're controlling the spread of the virus, and gradually stepping down and keeping a healthy state and a healthy economy.
Great. Well, thank you. And I will be turning this in a second to Jonathan Starkey. And I want to thank again all the many elected officials who are streaming in, as well as other members of our cabinet. Right now, you may not see all their faces, but we do have a number who've taken the time to also be present, and they're listening because it really does matter to us to have your feedback as we recognize at this time. So Jonathan Starkey will serve as our moderator, and we'll turn this over to Jonathan at this time.
Thank you, Lieutenant Governor. So we will take some pre-submitted questions as well as questions that you're leaving in the comments. We would ask you that you include your name. Obviously, your name is in the comments, but also your hometowns, so we know where you're from. The first question here, we've heard this question a lot. How do you see the reopening? This is from Tammy Wally. How do you see the reopening of daycares so people can go back to work? So how do childcare facilities fit into Delaware's reopening plan?
Great.
Lieutenant Governor.
I know that there's been a scale up. Certainly our executive order from our governor has put childcare protocols in place. We know right now they're serving those in our essential services. And I don't know if perhaps I would like Dr. Hong or also Damien, if you would like to jump in, because we know that childcare, myself as a mom, recognizes the importance of childcare and working, and they go hand in hand. So I don't know if Dr. Hong, if you would like to address in your mind, your view from childcare reopening and from the economic side. I don't know if Damien, if you want to add something.
So just talking about childcare, we understand the importance of that service there to maintain our workforce, whether it's in healthcare or in other industries. But we also recognize some of the risk involved in daycares, and we have received concerns about reopening daycares too soon because we don't want to have clusters of cases or cluster infections, especially impacting our pediatric population. So there is a balance to that, but they are top priority for us to make sure that when we decide to reopen, that childcare and daycare services are considered.
Great. Right. Damien didn't seem to want to add anything at that right at this time. So if not, we'll go back to you then, Jonathan.
Thank you very much. And I'm going to take the next question from Cindy Roberts. We're hearing this sort of question as well from lots of people. Cindy says, reopen the state, more people are affected by the economic conditions than the virus itself. Cindy is a single parent and an independent contractor. So can we address this? Why can't we reopen sooner? Dr. Hong, maybe you can take that from a medical perspective, and Damien can talk about the process of reopening.
Yes, and I think it's a great question because the economy is very important. Some folks are unfortunately impacted more by the economy than it is by the virus. But we are also considered that if we reopen too prematurely, we're not ready for that, and the virus is spread, it's going to impact our economy regardless. And as mentioned earlier, that if we're going to have to kind of go backwards and start over again, I believe the overall economy is more affected, negatively impacted by that. So we feel that we want to do this right with the least negative impact to the economy. We want to make sure that we decide to open, that it's going to be reopened at the appropriate time.
and I think Dr. Hong said it well. The only thing I would add is we want to make sure two things are in place. One, that we can have economic activity in a healthy, safety environment, but we also want consumers to feel confident that they can begin going out again, that they can begin enjoying in some degree the things that they were enjoying prior to this. And in order to do that, we need to make sure we're sending the proper signals. We need to make sure we're tracking the right data, and we need to make sure we're putting in a plan, engaging the business community, which is what we're working on right now, to try to come up with ways that they can transact, that customers can feel safe, that employees can feel safe, and that we can manage this in a gradual approach.
And I would just add to that, this is Secretary Cade from the Department of Labor. As an independent contractor, the federal law that was passed a few weeks ago provides federal unemployment benefits to independent contractors during this time period. However, the federal government has required that departments of labor throughout the country design specific programs tailored to these particular workers. Delaware's program, we expect to have it up and running in the next 2 weeks. So at that point, we'll be able to provide benefits to individuals who are independent contractors to make this shelter in place requirement a little bit easier to pay.
Thank you, Secretary Cade. And we did have a couple questions about independent contractors in the comments here. So can you say anything else about where independent contractors should reach out or when they may begin to receive payments? I think you said in a couple weeks. Is there any other information that you're able to share for independent contractors as it relates to unemployment benefits?
Is designing the program specific for Delaware. This is the same group who designed Maryland's program. And so we'll be meeting with them tomorrow to get a firm date as to when we can begin to take applications for these workers. It's important to recognize that while the federal law was passed, they did provide other guidelines as to how these benefits can be issued. Unlike some surrounding states that have thousands of employees who can process those thousands of claims manually, Delaware had to design an automated system. So you may see some states who are starting to take applications already because they have the staffing capacity to process all of them manually. But ours is going to be automated. So you'll probably actually receive your benefit a little bit sooner than other states who are doing it manually. So I know it's not easy right now, and it's hard to ask people to be patient while all of this is going on. But we expect to have that program up and running within the next 2 weeks.
Thank you, Secretary Cade. Two similar questions from Allison and Crystal from Harrington in the comments here. The question is, can we open all small businesses if small businesses can practice and enforce social distancing? And Damien, maybe that's a question for you.
Yeah, I think thanks, Jonathan. I think that's what we're working through as we develop our phase 1 reopening strategy. I think one of the things Governor Carney has done is appointed sector teams to go in and meet directly in particular industries where there's a lot of transacting with general public customers. So our restaurants, our consumer retail industries, our cosmetology industries, even nonprofits, and our museums and arts, and tried to engage those folks in a process where they help us to understand, one, how they can practice safe social distancing in their facilities, and how they can get buy-in from throughout the industry. I think one of the challenges as we design these things and as we try to make sure that we are maintaining safe social distancing is that every business is taking it seriously. I think businesses on the whole have done a great job through this phase of the process. I think as we enter phase 1, making sure we work with industry and that there's buy-in from them will help to make sure that that's maintained as we move into the later phases.
Thank you, Damien. And this is a question that we received pre-submitted from Arlene Humphrey, and I think it's a question for Dr. Hong at the Division of Public Health. Arlene asks, why do we put positive COVID patients in nursing homes? Would it not be safer to take them out and isolate them in another location? Can you talk about the Division of Public Health's work with nursing homes generally and specifically that question?
That is a good question. We get that question frequently. We work closely with the Division of Healthcare Quality, who regulates nursing homes, and this discussion has occurred, has happened multiple times during our response. And we do include experts within the field. We do talk to other long-term care facilities, providers, and things like that. One of the concerns that we do have in general about transferring patients with COVID is the fact that there's something called transfer trauma, where you have this population who's very comfortable in their environment, and more trauma could result if you take them out of that comfort environment and take them into a different environment, especially one very stimulated like the emergency department or even a hospital. And also we have to consider the overall healthcare continuum involving making sure that the resources are used where needed. So we still advise that even if someone has a suspected COVID-19, that they should not be sent to the emergency department, because the emergency department may not be qualified or may be best to take care of someone who's not sick and just slightly symptomatic and have to worry about the chronic issues. And again, that trauma transfer, we truly believe exists, that you place someone who is not comfortable in their environment, they may become worse. And also in hospitals or other areas, there might be other infections they can be exposed to. So this is a very sensitive issue, and we do deal with individual facilities to determine what's best regarding their residents.
Thank you, Dr. Hong. This is from Constance Schneider in the Facebook comment section. Constance asks, when would hair salons be able to open back up? Owners and stylists in these salons need answers, and I would just remind anybody we could use your help on questions like these. So I'd visit de.gov/economy and offer your feedback, get some sense of the reopening effort. But Damien, anything specific on hair salons?
Yeah, I think thanks, John. I think cosmetology business does pose some unique challenges. Just in practicing safe social distancing while performing the service. I know it is, like I said, one of the sectors that we are specifically working with to try to come up with a plan. Maybe that involves PPE, that involves some rigorous cleaning. We'd like to get them open in phase 1 or at least phase 2, but it is a little bit more challenging because of the nature of the service.
Got it. Thank you. And one follow-up for Secretary Cade from William Shearer. William's question is, will independent contractor payments be retroactive? Secretary Cade.
So independent contractor payments will be retroactive to the date that the state signed its agreement with the federal government, which was the day after the bill was passed. So the bill was passed on Friday, the 27th. We signed the agreement on the 28th, and so payments will be retroactive to March 29th.
Thank you, Secretary Cade. So this is another question we've gotten quite a bit. Michelle Kleinhomer in a pre-submitted question asked, since towns in Delaware seem to have the virus more under control than others, can we reopen Delaware on a town by town or a county by county basis? Is that something that we've given any thought to?
I don't know, Dr. Hong, if you want to jump in and then others can follow.
Sure. So we have looked at opportunities to open certain sectors of the state sooner rather than later, but we do have to be concerned about travel. And it's very easy to jump from one town to another town or one county to another county. And if we kind of recall how we end up with COVID-19 here in the United States, it was travel related. So we do have some considerations. Maybe we can open parts of the state sooner rather than later, but I can't say at this time whether we're going to do that or not.
Thank you. I know that our governor had shared in the press conference that there are those distinct differences, the hotspot in Sussex, and then people in the Newcastle area, the leveling, but it's all dependent on what our behavior. And I know our secretary and Damien know for the businesses that's a key question. And some of the great information we gathered last night in dialogue, and hopefully tonight we'll get some more comments and some thoughts from the community as we look at those questions. So thank you for that question. Back to you, I guess, Jonathan.
Thank you. And I know a lot of questions tonight. We have a couple questions here, one from Ralph Picard, who owns 3 vacation rental homes in Fenwick, said he's refunded payments to all of his guests since the pandemic shut down, but wants to hear about any plans for reopening the beaches. I don't know, Damien, if you have anything to say about this. Also, Dr. Hong, if you can talk about the challenge and social distancing, I think that would be helpful as well.
Dr. Hong, do you want to start with that, and then I can follow up?
Sure. So definitely, prior to opening any areas in the state, we want to make sure that we still continue effective infection control measures. So opening the beach towns, I love the beach and I'm missing the beach right now. But I can imagine how difficult it may be to maintain social distancing, whether we are going to continue with universal mask precautions as well, to hygiene as well, to are there enough hygiene stations in those areas? You can imagine that, in that environment, it might be very difficult to maintain effective infection control measures. So that we're going to have to balance that because we don't want to open up those areas and then see that we are seeing an increase in a number of cases.
And the only thing I would add to that is we've been talking with some of the local towns down there who are would be responsible for controlling access to the beach in normal times. And there are some challenges there with making sure that's maintained. So any plan that we come up with to reopen the beaches, we'll need to make sure that we can monitor the number of people on the beach, because ultimately that's the best way to maintain safe social distancing.
And thank you all for that. Don't forget, I know our Kent County delegation has spent a lot of time on the coastline that touches also Kent County, whether Bowers Beach and Woodland and others. So again, we know that there's been a close eye, and some of our other cabinet secretaries have worked closely with the local towns around the permits and the fishing and the activities, our waterways and our watermen. And so I know for the General Assembly members who are actively listening tonight, that there is that unique caveat that I know the governor's office and others are quite aware of. So thank you. Back to you, Jonathan.
Thank you, Lieutenant Governor. The next question is from Karen Weintraub in the Facebook comments here, who asks, are there any plans to increase testing in Delaware so that people can feel more comfortable about going out in public? Also, as everyone has said, increasing testing is an important part of reopening Delaware's economy. So Dr. Hong, can you talk about testing and what we're doing specifically in Sussex County and maybe statewide?
Sure. So we agree that testing, especially widespread testing, is needed to know for sure whether reopening is the right thing to do. A lot of factors are in play regarding when we're going to do that widespread testing. And one of them is capacity. We have to make sure that the priority groups who need testing at this time are met. But as we expand our testing capacity, then we can expand the priority group, so to speak. As you know, Sussex County, we are conducting widespread community testing within our hotspots because of the high prevalence rate of cases that we're seeing. We need to know what's going on in those communities to be able to implement effective infection control measures. So that's a special situation in which we are doing more widespread testing, which may include asymptomatic cases, because we need to know who's infected, who's not infected, who's at risk, who's not at risk. So that'll give us more information and help tailor our approach in how to contain the disease in those areas. But I totally agree with you that once we get to a point that we can perform more widespread testing in order to reopen, we will do so.
Thank you for that. And I know many of the cabinet and others who are tuned in tonight have spent a lot of time on the testing concerns, and particularly with some of our more vulnerable populations or our communities with diversity and socioeconomic and other background factors. So thank you again for sharing that. And I know Damien in his first slide, showed how we will be relying on data and numbers with testing as we look at the White House directions that they've provided in the CDC on when we open after that 14-day window, et cetera, et cetera. So thank you.
Thank you. Question here from Denise Best, who says, this is for Secretary Cade. I have been trying to reach the unemployment office by phone, fax, and by email, and have dropped off a letter in the outside slot. What is the best way to go about contacting the unemployment office to ask questions about benefits, Secretary Cade?
So as I said before, we've had thousands of people who are applying for benefits. So hold times it may be a little bit too, maybe a little bit long. If you email UI claims at Delaware.gov, we will make sure that we get to your claim as soon as possible. If you dropped off something in the mail, it obviously means that someone reached out to you to ask you to do that because information may have been missing from your claim. So they're going through those mailings daily, and they should get back to you very shortly.
We also had a follow-up question here about the timing of federal payments, the federal unemployment payments through the stimulus, the CARES Act. Can you give people a sense of timing? Are those benefits, how many benefits have been paid to date?
So for the federal portion of the benefit, if you qualify for unemployment and been receiving unemployment, you would have received a $600 added benefit starting the first week of April. So that benefit has already started being issued weekly to workers if you're talking about the unemployment benefit. We also have already implemented an added 13-week extension of unemployment as of last Sunday, not this past Sunday, but last Sunday. So those federal benefits have already been added. I'm not sure if they're talking about the federal stimulus, which you'd have to check with the IRS with regard to your federal stimulus payment.
Thank you, Secretary Cade. So one more here from for Dr. Hong from Jimmy Johnson, who asks, are we allowed to gather in groups of 10 or fewer if we use social distancing guidelines? I know a lot of Delawareans have asked this. Is it okay to have family over for dinner if both families have been self-quarantined for more than 30 days? What would your advice there be, Dr. Hong?
So the concern right now is that, there's always some risk out there given the prevalence of disease in the state. So I would always caution that, there may be a chance, even you doing everything right regarding infection control measures or even quarantine, that there might be some chance that you might be able to spread illness. So I highly recommend you use your judgment. I haven't seen some of my family for a very long time because I'm out of my family. I'm the one at highest risk for getting this disease as I still practice medicine. That you need to weigh the risks and the benefits of having such encounters. If you feel that you need to have a social gathering, again, limiting your number, less than 10, social distancing would be fine, but there's always some risk involved. And I really caution you, if you decide to do that, make sure you take all precautions.
Thank you, Dr. Hong. And another similar medical question, Sylvia from Camden asks, when is it safe to go to the ER when you have a lot of medical issues? We know folks have medical issues, certainly other than COVID. Is it safe to go to the ER? What advice would you give to Sylvia?
And that's an important question. Thank you for asking that. I am an ER doc by trade, so I'm very familiar with the chaos that may occur in our ERs. However, the ER or the EDs are there for a reason, to take care of people who need those services. And we are unfortunately seeing anecdotally that people are waiting a little bit too long with life-threatening illnesses to go to the emergency department because of the concern that they may get COVID. And I kind of caution folks, don't wait too long if you truly need the services of the emergency department. And I am very confident to say that the emergency departments in the state are prepared to take care of patients without COVID and to protect them from getting COVID. They are implementing many measures to segregate, to separate folks with COVID symptoms and folks without. The staff are trained with PPE to make sure that they don't pass disease from one patient to another. I think that the infection control measures that are placed within the EDs make them safe if you need to go to the emergency department. So if you need to go, please do go.
Thank you very much. And this next one is for Damian DeStefano at the Division of Small Business. We've had several comments about questions about shortages of hand sanitizer or personal protective equipment for businesses as they reopen. I know we have questions about this on our form at de.gov/economy. Can you give any advice on what kind of feedback would be helpful, Damien, for businesses who are worried about hand sanitizer or personal protective equipment, masks for their employees?
Sure. I know there's a group within the state, I believe being led by the Office of Management and Budget folks and the folks at the Emergency Management Authority, DEMA, who are working on this issue, trying to centralize procurement. It began as a centralizing effort for the state's needs. I think it's expanded to include others, including some businesses, and I believe now they have a portal which we can get the address to for folks, where as a business owner you can go on and explain what you need, and add to the list so they know how to make their purchases. I don't know that they'll be able to get every need met. The demand is very high, both within the state, within the healthcare system, and within the business community. But I know they're trying to purchase those things as much as possible.
Thank you, Damien. And another one we've gotten a lot of questions on. This one's from Jill Buffon in the comment section here on Facebook, who asks, are we looking into contact tracing? And also, could Dr. Hong, could you explain, and maybe the Lieutenant Governor as well, Bethany Hall-Long, what contact tracing is and what we will need to do around contact tracing as we move toward a reopening?
I'll defer to Dr. Hong first. I know he has a little tighter schedule this evening, and I'll chime in if I need to. Go ahead, Dr. Hong.
All right, well, thank you. So contact tracing is a very important part in our response. The process of contact tracing is fairly simple, but it is complicated as well. So once a case has been identified as being positive, our epidemiologists will work hard to determine who's being in close contact with that case. And they do an investigation for those close contacts as well, and also educating them that they need to practice effective infection control measures, which may include quarantining at home. And then they also want to make sure that those contacts are aware as well too. So again, to reduce the spread of disease, we have to make sure that if the disease is spreading, we have to make sure that we contain the infection to those that are potentially exposed. So in a nutshell, I think that's a description of that. Contact tracing is important in our overall plan of reopening, and we are looking at additional resources to expand our contact tracing capabilities.
And thank you for that. And to the people speak, it basically is about, as you state, identifying those who have been infected or been exposed, tracking them. And we all know until we have vaccination or we have treatment, we have to rely on testing, and contact tracing is another tool and an important tool in the toolkit, which I applaud our Division of Public Health, who's working really hard now, I know, in the governor's leadership, to really address all of those tools. And again, we're excited to hear the plan that's going to come forth in contact tracing. So thank you. And for the experts, Dr. Hong will tell you, who are out there, those volunteers, the retired nurses and doctors and others who want to step up, we have a website that you can also visit through our Medical Reserve Corps, right, Dr. Hong? So to those listening tonight who have a little time and want to help out, we welcome your help. Thank you for that. Back to you, Jonathan. Oh, go ahead, Doctor.
No, and I agree. Thank you for a shout out to the DMRC, our Medical Reserve Corps. We're fortunate to have a large group of volunteers, some medical, some non-medical, but really we can use any skill set out there to be able to help us in this. And they've been very helpful in many ways, helping with our testing sites, participating in some long-term care initiatives, providing community outreach and education. So there's a spot for everyone. So if you are interested, please look into the website and consider.
Thank you. Jonathan, we didn't mean to go to that complete commercial, so to say, but I know that Dr. Hong may have to sign off in a few minutes. So I don't know if there's other health questions before he has to sign off as well.
Yeah, let's do one more for Dr. Hong. And Dr. Hong, you talked a little bit about this earlier, but we have a question from Serena Williams in the Facebook comments, who asks, what are we doing to protect our workers in poultry processing plants, also in nursing homes? Can you talk again, for anyone who wasn't on, about the additional community testing and outreach in Sussex County, as well as Division of Public Health work in nursing homes?
Sure. Just a general information. We do have a website for coronavirus. It's on the screen. It's www.de.gov/coronavirus, and really has information that's tailored to specific target populations. So there is a tab for healthcare providers or healthcare staff. There's a tab for essential businesses. There's a tab for testing. There's a tab for vulnerable populations and a tab for long-term care facilities. So we have been working very closely with all these partners and more to really provide recommendations how best to protect yourself, your staff, and your patients or your customers. So, we have worked closely with long-term care facilities. We have provided educations to all our long-term care facilities. We also discuss best ways to use PPE or personal protective equipment. We also help getting them resources as well. We also provide testing on site as needed, depending on the situation. Poultry plant, same thing. Since we learned of a first case in one of the poultry plants, we actually had a call. It was on a weekend, I remember. It was a Saturday. We had a call with their leadership, and we talked about what the situation was, what implementation of infection control measures they've done. And we actually made site visits to the poultry plant to really provide hands-on, on-site recommendations, and really appreciate the partnerships with our long-term care as well as the poultry plants to really help focus on the public health side of their workers, their customers, staff, and so forth and so forth. So we've been very successful with that. We have also offered testing, not just for the poultry plants, but we had a community testing site earlier today in Georgetown, again, to really help address some community concerns with the hotspots or the increased prevalence of infection. Also providing social services support to help them maintain those infection control measures in the home setting. So we're doing a lot of good stuff. And again, really appreciate the partnership with everyone to make this happen.
Great. And I will add the health systems have really stepped up statewide. And for those who are in Kent County tonight, since we were focused in Kent, they too have available different testing measures. And if you call 211 and other resources in our state, we can try to also work with you and help you be connected as necessary.
And Dr. Hong, just before we lose you, I know you also answered this before, but for folks who were not on, Serena asked, could someone give a detailed explanation as to why it's imperative that we not open the economy too soon, so people will understand what is the concern with opening the economy too soon?
And that's a great question because everyone's eager to reopen. I am as well too, because I need a haircut, if you guys can see. But we want to make sure that once we reopen, we do it right and we don't go backwards. There's always a concern of reopening too soon and the infection is not quite controlled yet. And opening up businesses, opening up the economy, more people will go outside. Social distancing will be harder to do. People may forget infection control measures, and as a result, the infection may just spread even more. So that's a very important message. Thank you for allowing me to share it, is that we are focused on trying to reopen as soon as possible, but we want to make sure it's done safely or we're going to have to start over again. And I think none of us really want to do that. So our goal right now is a tiered approach to reopen the economy as long as the infection is controlled at that point. And hopefully once we open, we stay open.
Thank you. Thank you so much for joining. We'll continue our Facebook chat along here with Damien and our secretary, but I know Dr. Hong, thank you so much for your service. I know that you have an important phone call. I know every day you're fighting and protecting Delawareans, and we appreciate your joining us tonight.
No, absolutely. This was great. And I appreciate the opportunity, and, just want to wish everyone to be safe and remember to wash your hands, cover your mouth when you cough, and practice social distancing. We really need your help to get our economy back online. So thank you very much.
Thank you, sir. Jonathan, back to you.
Thank you, Lieutenant Governor and Dr. Hong. So Damien, I think a couple more for you. We have a couple folks in the comments here asking why are hotels not until phase 2? Also, when can we open non-essential businesses? You did this earlier in the call as well, but for people who have joined in the half hour since, maybe we can put the slides back up. Can you talk about the timing in between phases and what we're looking at in terms of reopening?
Sure. So yeah, phase 1 is going to be really a limited, moderate reopening of some businesses. Many of the non-essential businesses, particularly those in the consumer-facing retail sector, which is where a lot of the non-essential designations fell, will be able to reopen in some capacity. We're looking at exactly what that looks like right now. How many people can be in a store, whether they can transact by appointment, strategies to allow them to reopen, but again, maintaining safe social distancing being one of the keys. As for hotels, they're open for essential guests right now. During phase 1, you really don't have a return of non-essential travel, and there may still be out-of-state travel restrictions. So we're really not trying to encourage leisure travel at that point in any capacity. As we move into phase 2, that's when we'll really be looking at some relaxation of those. You're going to see non-essential travel resume. we're going to continue to look at out-of-state travel. That will depend largely on the numbers from surrounding states as well, and the numbers we're seeing here. And then I think you can start to look at things like hotels and other leisure businesses going back to operating at a higher level of capacity. That includes restaurants, it includes bars, which will reopen in phase 2 in some capacity. But that's really how you ought to think about the phased approach, is really a slow step up towards through the phases towards normalcy, that we can hopefully continue to see a downward trajectory, so we can move through the phases more quickly.
Thank you, Damien. Dale Matthews in the comments on live stream says many businesses are unable to keep up with rent and loan payments. I know, Damien, that you hear this a lot. If we have a plan to work with small businesses, can you talk about what that plan would be? What information we need from small businesses who right now are struggling to keep up with rent and loan payments?
Yeah, so the state has some assistance program, one assistance program for specific businesses in the hospitality and cosmetology sector. Our office has been helping folks apply to that. It's called the HELP loans, the Hospitality Emergency Loan Program, that's specifically targeted at providing loans for rent and other expenses like that. The federal government has programs, the payroll protection plans. Many small businesses have applied for those, and some have gotten funding through that program. It's been incredibly helpful. And the economic injury disaster loans, also through the Small Business Administration, another federal loan program, is a place where folks have applied. But I think ultimately our ability to move into phase 1 and phase 2 is going to be key to helping a lot of these small businesses get back on their feet. To do that, we need to make sure we're moving prudently, so that consumers have confidence, so that we don't see a reoccurrence of the virus. But as we do that, I think we're going to see hopefully customers return, and many of our small businesses experiencing a better level of revenue than they are right now.
Thank you, Damien. And maybe we'll give this one to the Lieutenant Governor. We have several folks commenting on masks and the governor's updated emergency declaration about masks. Nay Garcia says in the comment section here that she's seen people wearing masks with their nose out, not covering their nose or not covering their mouth. Can you talk about best practices around face coverings?
Yes, I can. For those who don't know, I am a professor of nursing and public health. Not everybody's going to have a mask exactly like those of us in the health field here, but I've demonstrated that. I would highly encourage that. The reason that we want to make sure you're covered is to protect others. We really want to ensure that we have face coverings, and we want to make sure that you have a t-shirt at home, you have a bandana. It is really important when you go out to protect others. We also know my colleagues, my former students, my current students need to have the official masks that we have available, the N95s. I demonstrated to you the point about the mask. If you don't cover your nose and you don't cover your mouth, you're not really protecting others. So you really need to cover your full face. Again, I know it's a little discomfort, but it can go a long way. A lot of the times we don't have symptoms. You may not have a fever, you may not have that cough, you may not have those issues. And what you're going to do is perhaps pick that up, have touched something, go home and, share with others when you cough, when you don't cover and touch. So really the mask is a very important thing. And we've evolved. We have followed here in the state the Center for Disease Control and Prevention guidelines. Initially, we did not have a lot of masks, so we didn't have the mask. We've learned a lot in the last 6 weeks with this virus. And so for those who question, why the mask now? It's really important that we have the mask now. We know that it's living longer, that it is durable, that we have to have protection. And so the mask is vital. So again, we are following those directions closely. And so thank you. If you see someone perhaps that's out with you, if you get into an elevator and someone doesn't have the mask, you step out of the elevator and you kindly say to the person, we're under the order to cover. And a lot of times it's just having information and having the ability to share with others. So I hope that helped a little.
Thank you, Lieutenant Governor. In the comment section on live stream, Carrie McElwee says, what is the coalition doing to ensure our state is safe while other states are not following the same process? I think that Carrie is referring to the Multistate Council that we're working with on reopening and recovery. I don't know if Damien or the Lieutenant Governor can talk about that Multistate Council and the role, what Delaware will get out of the council as it looks at reopening.
I mean, I can just briefly make commentary, and I know whether it was Damien or Secretary Cade or others, we have others who are listening in tonight. You know, we are so pleased that Secretary Walker, who is a physician and leads our Department of Health and Social Services, along with Sheila Grant, the governor's chief of staff, as well as Kurt Foreman, who joined us the last 2 days. So those of you who are from the business sector are getting together and looking at those best practices. And I think, Damien, if I can turn it to you now, you can talk about why we need to have those coordinated efforts.
Thank you, Lieutenant Governor. Yeah, so we have for a long time, I think one of Delaware's strengths in being able to attract new business investment has been our position. The fact that we are situated on the eastern seaboard between a number of states with large cities, large populations, and that has been an advantage to us. In this case, being in a small state surrounded by other states means that we're at a bit of a disadvantage because we can only move as far as they move, and make sure that we're controlling the spread that might inevitably come across those borders. And so I think working in a multi-state capacity to try to come up with a strategy where we might treat individual industries within our states differently, but we're all making sure we're moving towards a gradual reopening and all working in coordination as we do that is the best way to promote health for our citizens, because it's the best way to promote health in the region.
Great. And Jonathan, we'll go back to you. I know we're winding out the hour, and I want to ensure that folks do go to that de.gov/economy and do give us the feedback. And I know that our Cabinet Secretary Cade, I'm sure, has endless information that he's been experiencing. And I don't know, you know, Jonathan, if you have some final questions or if we've had a lot of questions come in, I know we might go a couple minutes over. I'll leave that to you, Jonathan, in your discretion.
Yeah, why don't we take two more? We do have we had a couple that were similar, Secretary Cade, to a question that I think you got yesterday about the budget impact of unemployment insurance claims. Can you put that into perspective for people, and if the state of Delaware is in a position to cover the budget impact?
The state of Delaware would not be able to cover without the federal assistance that is expected that has been received. The federal government provided $1.25 billion to the state of Delaware to provide some relief for expenses related to COVID-19 that were not budgeted. One of those expenses is going to be the stabilization of the unemployment trust fund to ensure that unemployment benefits are available for individuals after this crisis is over, and at the same time to ensure that businesses and nonprofits do not have to encumber huge tax increases in order to replenish the fund, which could negatively impact job growth coming weeks or the coming months. So we expect to be able to use those federal assistance for that purpose in order to prevent from having to dip state funds in order to provide that.
Thank you, Secretary Cade. And I have, we'll end with a question about PPP for Damien. We have a lot of questions. One from Lisa Lawson about the small business, the federal the small business program. They said the PPP won't work if we can't get our staff back. I have 50 employees in a closed business and 8 weeks to use the money, and most of the staff is part-time. Can you just talk about, before we wrap up, small businesses in Delaware, who they can reach out to and to get answers to those kinds of questions, and specifically about PPP?
Sure. Yeah. So we have a website right now, business.delaware.gov/coronavirus, that is specifically dedicated to some of the economic issues surrounding coronavirus, assistance programs, ways to reach out to our office for assistance. We're glad to talk people through any questions they might have, or connect them with somebody at the SBA or the SBDC. On the PPP specifically, one thing I would make sure folks are aware of is that it can be partially forgiven. So that it's just for folks out there who aren't familiar with the payroll protection plan loans, they do get forgiven as of June 30th if you were able as a business to have your wage levels up to where they were prior to March, or I think mid-February. So a lot of folks have taken these out. If you're able to hire back a portion of your staff, you get a portion of the loan forgiven. So that's something to certainly keep in mind as you evaluate whether or not the PPP makes sense for you. And then for those who aren't able to or don't feel confident in their ability to bring back many of their staff, there are economic injury loans. And then if you're in one of the sectors that is eligible for the help loan, that's another way you can get assistance. So I would just encourage you more than anything to reach out to our office if you have questions, if you need assistance, and we'll try to find out the best avenue for you that might meet your specific business needs.
Thank you, Damien. And just a reminder that please visit de.gov/economy to submit your feedback and to learn more about reopening and economic recovery planning in Delaware. And for the latest updates on coronavirus in Delaware, visit de.gov/coronavirus. And I'll turn it over to our Lieutenant Governor for closing remarks.
Yes. Well, thank you all. Again, I hope that tonight has been informative. We are all living in a different time. We're not face-to-face tonight. This is our virtual town hall. We will be soliciting your feedback as we launch 3 others across our state. We want to thank again all the members of the General Assembly and the commissions and the county level who participated. And please use our website, as Jonathan stated tonight, and to our incredible interpreter who's always with us. I want to thank her. She reminds all of us that all populations are suffering now. If you have a loved one who's a vulnerable population or an elderly neighbor, this is the time people have social isolation. I know tonight we're about the economy, but many of you have employees, you're working differently, you're at home doing homework with your children. Things are very different. Turn to the resources at de.gov/coronavirus, call 211. And again, thank you so much to Damien and Secretary Cade and to all the other secretaries who were listening in tonight. And on behalf, I know, of Governor Carney and we want to thank you. Please submit us your feedback. Stay safe, stay well. Thank you, Delaware.